what inspired your shift from kind of a COO at AIM to actually founding Bloomwell?
Being in the ABA world, there's need everywhere. Like, we all know that the demand for ABA far outweighs the supply. However, there are places where that is even more true. So in the big states like Florida, California, Georgia, there's still a supply-demand imbalance. But, it's a little less than in places like where Bloomwell is, Minnesota or Nebraska, where they had these kind of weird regulations that were artificially suppressing the supply of ABA in those states. And so we decided to create Bloomwell and do something about it. We decided that we were going to be the ones who were going to take on those like extra burden of those regulations, figure them out, figure out how to provide ABA within those regulatory frameworks, because the people in Minnesota and Nebraska deserve ABA as much as anywhere else in the country. And so that's kind of how we founded Bloomwell and what led to the transition.
That's really cool. It's very smart to pick a clear differentiator right up front as opposed to after the fact, which is really cool. That's awesome. So then how do you approach building out a sustainable program in those new communities over and over and over again? Because I know you guys are growing quickly as well.
Yeah, sure. We are growing very quickly. The first piece, I think, is creating a culture and program for our teammates that makes them want to stay. That's the first part to me, because you can't provide quality care without quality people. And so that's what we focus on is, all of our behavior technicians are full-time. They have benefits. We offer them proprietary training program that we created internally, and all of these things so that when we hire folks, they feel prepared. And then when they feel prepared, they stay and stick around and then learn and can do a better and better job. And so that's, to me, is a sustainable model. It's the model of just turning over everybody every year is not sustainable and not what we are about. And so it's maybe a little more expensive up front, but in the long run, definitely pays off and allows us to scale, because our folks aren't focused on replacing our current folks. They're focused on recruiting new teammates to staff the new locations that we're building.
I wish more organizations understood the value of retained staff and how much it costs to train and to constantly be handling turnover. I mean, especially
exactly
beyond the operational expenses, the cost to clients.
Exactly.
And the relearning of every new patient and all of that is not worth it generally.
Yep.
That makes perfect sense. So then I'm sure you've learned a lot about kind of operational efficiencies in the ABA space throughout this whole process of growing Bloomwell. What are some key takeaways or some efficiencies that you wish other ABA leaders knew and that you'd like to share?
So one of the things that we're trying this time around is a much more kind of dispersed, decentralized management model. At AIM, it was pretty centralized. Like the central team was kind of managing the budgets and intakes and all of these things in the clinics. Now we're taking the approach of, okay, clinics, like here are goals for you. You meet them however is best for you. You know your people better, you know your area better, you know all these things better than we do. So here are goals for you. Now you are the ones responsible for meeting those. And not only does it pay off in that they do know their specific situations better than a centralized team would, but it also gives them ownership over the performance of their clinic, gives them ownership over leading their team. They feel much more kind of invested in the culture and the performance and everything at their particular location. And so while, it may seem a little more complicated or not as efficient to kind of push these functions out rather than bring them in and make them, centralize them, we found that that's actually not the case. That, giving people ownership and letting them figure out the best way to do it for them actually has turned out, for us at least, to be more efficient and have several other benefits too.
Absolutely. You gain efficiency because of effectiveness, right?
Yeah, exactly.
Technically, you had to have 10 people make decisions, but all of those decisions actually played out and actually worked, as opposed to one person
actually worked.
that only worked 50% of the time.
Yep,
That
exactly
makes
it.
complete sense. That makes complete
Yeah.
sense. That's
Yeah.
awesome. So then, how does kind of your background in public policy shape your leadership at Bloomwell?
Yeah, I think you could ask this question to anyone who's worked with me, and they tell you. I think they know the exact answer. One of the things that I'm really passionate about, and my background in policy really helps with, is the advocacy part of our job and taking care of our kids. So whether it's advocating on behalf of our families to an insurance company, or advocating to state lawmakers or a Medicaid regulator on changes that we think would help improve access or improve quality of care for our patients, having like a deep understanding of how those systems work and what they care about, what they don't care about, the rules that they have to follow really helps whenever you're having those conversations or setting up and preparing for those conversations. And so in my opinion, my background and my public policy background has been invaluable to helping affect systemic change in the states and markets and communities that we work in.
That makes complete sense, and it makes sense to use your position as a provider for better and more, I guess,
Exactly.
more informed advocacy, right? Because you're also
Yep.
from inside of another system.
Yep. Exactly.
That makes complete sense. So then, speaking as an advocate, what is one piece of the ABA system in all the states that you're in that
Sure.
you would change overnight if you could? If you had a magic wand and could fix it right now?
Yeah. So I can tell you the one thing that I wish would happen. I wish that, and I know there's nothing that we can do about this. This is just the nature of how things have evolved. But I wish that, the average age of BCBA was a little higher. Being a BCBA, being a good BCBA isn't just writing great treatment plans, providing great supervision, and really helping your patients make progress. That is a large and very, very important part of the job. Another large and important part of the job is managing your team. You have a team of RBTs. You have to learn how to manage them effectively, have conversations with parents, and sometimes manage parents. And those type of skills aren't necessarily always taught in ABA programs, and sometimes have to be learned on the job. And so typically a more experienced person has more experience interacting with people, managing people, all of that. And so I think that when the ABA industry matures even a little bit more and BCBAs have more experience and all of that, it'll make the quality of care better. It'll make things more efficient. There are a lot of benefits, I think, from our BCBAs having a bit more experience.
Yeah, yeah. You make an especially effective point because you're also a younger professional too, right? I think when more mature professionals say that kind of thing, I think almost everyone kind of writes it off immediately as like,
Yeah.
they're just saying it'd be better if you had my age.
Yeah.
But I do think you're right. I mean, experience adds value. In
Yeah,
almost always.
yeah, yeah, definitely. And I mean that's something that we emphasize at Bloomwell. In fact, a large part of our BCBA training and onboarding program, yes, is teaching folks the clinical way that we do things, but it's also leadership skills, professional development, like all of that is a huge part of our continuing education, training, and onboarding program too. Because, like I mentioned, just in school, which a lot of our BCBAs are just coming out of school, and not having worked for a very long time. Those skills are super important.
Absolutely, absolutely, super important and hard to gain without
Yep.
doing it. You just have to.
Exactly.
You have to actually have experience in the space.
Exactly.
Yeah, that makes perfect sense. Well, thank you so much. Those are our burning questions. So we'll wrap up. But thanks so much for hopping on, and we really appreciate
Yeah.
it.
Yeah. You're very welcome.